welcome Dr. Karen E. Burke of the Mount Sinai Medical Center here in the USA.
Thank you. Well, it's great to be here and to present to all of you. I think we have a mini UN here. So I think that all of us will make friends and maybe have future collaborations. So I want to thank the organizers for having invited me. Is there a way to just have the screen rather than all the side pictures? But I'm going to talk about topical antioxidants to protect and reverse environmental stress. And the skin is the organ that has the most environmental stress, not only from the sun, but also from pollution and one of the main pollution indoors is still smoking. But the problem is sunscreen is just not enough. Usually, no one applies enough to get the full SPF on the bottle, and often there are lots of areas that we skip. Also, it has to be applied every hour and a half, even if you don't know you're perspiring, and even indoors we should apply sunscreen because UVA goes through windows. So, and even when it's cloudy and in winter, we should apply sunscreen. So this just shows that most people apply 1/4 of the amount of sunscreen as required when the SPF is measured. And long ago in the 70s, they decided to put 2 milligrams per centimeter squared on skin and just see how much UV goes through glass with that amount on the glass. But individuals can only apply about 1/4 of that amount. So an SPF 30 is essentially an SPF 2.3. And to apply enough, you'd have to apply almost 1.5 bottles of sunscreen every hour and a half for a woman wearing a bikini or a man with just swimming trunks. So, and even if applied properly, the sunscreens don't block all the free radicals. Only about 55% of free radicals are inhibited, and the sunscreen doesn't protect against other environmental free radicals, only against the sun. So we did experiments in our lab to show the problem that there is a kind of synergy of damage between UVA and environmental pollutants. Most of the pollutants are polycyclic aromatic hydrocarbons, but in the lab we use benzalpha-pyrene, BAP, as a measure. And this is ubiquitous in the environment from cars, from fossil fuels, from power plants, and from cigarette smoke. So cigarette smoke doesn't only have tar and nicotine, it has these benzalpha-pyrenes. And the levels in any of our cities, even the most polluted cities of the world, most of which might be Beijing and Mexico City, don't have enough environmental pollutants to really hurt our skin. It can hurt our lungs and our eyes, but not so much our skin. However, UVA, I will show you, acts in conjunction with the pollutants to become toxic and tumor, so that the whole environment is then toxic and tumorigenic to our skin. So there is an index of environmental polycyclic alpha pyrenes in newspapers, and in fact you can sometimes see it in the newspapers of Beijing and Mexico City. But these environmental pollutants, or the synergy, initiate skin cancer, and metabolites interact with DNA also to induce carcinogenesis. So a high dose of each alone can be carcinogenic, but the low dose that we would all experience is not carcinogenic. However, a low dose of both together, 1/53rd the amount of benzalpha-pyrene that is polluting, combined with 1/8 of the amount of UVA that might be detrimental to us, it can be dangerous. And this just shows, this is a mouse model where we have mice exposed to either UVA or to just benzalpha-pyrene. and none of them get cancers. But when we expose them to both at the same time, the mice do get many cancers. And this just shows the number of mice that get cancers, the percentage, and this shows the number of tumors per mouse. So then we can see that there is directly damage, and this just shows a low dose and a high dose of UVA combined with benzalpha-pyrene. So alone, there is, with just UVA, there is no DNA damage. But when the animals are simultaneously exposed to benzalpha-pyrene, there is direct DNA damage, as measured by 8-hydroxydeguanosine. And again, however, when exposed to UVB alone, and with benzalpha-pyrene, there is very little damage in comparison with UVA. So then, now we can see that also the benzalpha-pyrene interacts with UVA to cause adducts in the DNA, benzalpha-pyrene diol epoxides, which bind to the DNA. And again, with UVA alone, none of these adducts form, and with benzalpha-pyrene, some form, but when exposed to UVA in conjunction with benzalpha-pyrene, there are double the number of DNA adducts. So the model that we propose is that the UVA can interact with environmental BAPs to cause these metabolites that act with DNA, that add on to the DNA and cause mutations, initiating cancers. Also, UVA directly can stimulate reactive oxygen species, which also directly can cause DNA oxidation and initiation of cancers. But the free radicals also cause a cascade of signal transductions that further promote cancers. So this is how we think that skin cancers are especially initiated by environmental pollutants. So cigarette smoke is terrible for the skin, and it certainly decreased wound healing. No plastic surgeon will do a facelift if the patient is a smoker, and in fact, that patient should not have smoked for at least 30 to 60 days before the surgery. And 78% of the problems in plastic surgery are in smokers. So there's also smoking causes a premature appearance of wrinkles. It causes, it increases psoriasis, but mostly it increases skin cancer. Melanoma doubles, squamous cell carcinoma goes up by a factor of 1.5, but lip cancer is increased by a factor of 15, and oral cancer by a factor of 78. Almost every oral or throat cancer is in smokers. So this just shows a more immediate reason not to smoke, and that's that you get many more wrinkles, many more dark spots, dryness, leathery texture, sagging, a pale pallor, and even yellow teeth. So this just shows two neighbors. These were my patients in North Carolina, and the 57-year-old non-smoker who grew up and lived within a few houses of her cousin did not have many wrinkles, but her smoking cousin, as you can see, looks far older. The cousin was 5 years younger. These are now twins, where the twin on the left smokes, and you can see she has many more wrinkles than her sister on the right. And this is the most dramatic. This is a 29-year-old girl and twins. And the twin on the left smokes and just looks far worse than her twin sister. So this just shows, if we look at the skin very closely, you get big, deep furrows if you're a smoker. So this is an 87-year-old that didn't smoke, that has crepey skin because she's old, but not these deep furrows of someone a little younger than she, but who smoked 44.5 pack years. So this is why we need topical antioxidants, because topical antioxidants can protect and reverse some of this damage, not only in sun damage, but also the kind of damage smokers and people exposed to pollution suffer. So topical antioxidants protect against both UVA and UVB and pollution. They reverse the premature aging from UV and from cigarette smoking, and they provide a reservoir of protection in the skin. So the other thing is that UV actually depletes the levels, especially of vitamin C. So just about 15 minutes in the sun makes the topical UVC go down by 30%, and about an hour in the sun might cause it to go down to even 54%. Vitamin E decreases very little due to sun exposure. And furthermore, exposure to ozone. Now, this is an experimental model that shows when mice were exposed to high doses of ozone, the vitamin E decreased and the vitamin C was decreased in a major way, 55%. And the melanoldialdehydes, a measure of free radical damage, increased by a level of 10. However, there is no city in the world now that has this much ozone. There had been in the 70s. Even cities like Pittsburgh and as well as Mexico City at that time had high ozone. So smoking, as I said, depletes antioxidants, and we see that in smokers, vitamin C is about 24% depleted, and smokers are 3 times more likely to have a low vitamin C than other people. And the levels of vitamin E, of glutathione, and selenium are all lower in smokers than non-smokers. So it really is good to take topical antioxidants, but that is not as helpful as oral antioxidants. As the oral antioxidants are not as good as topical in treating our skin. So I recommend, and I think we need supplements. So to take what I recommend, which is 1,000 to 6,000 milligrams of vitamin C a day for our own nutrition, you'd have to eat 100 oranges. To take vitamin E, I recommend 400 international units a day of the kind that's D-alpha tocopherol acetate or succinate. And this would be equal to 44 tablespoons of sunflower oil, which is disgusting, and it's also 5,275 calories. Selenium, I recommend that everyone take 100 micrograms a day, and you would have to eat really 50 portions of salmon to get that much selenium just from fish, or you'd have to eat a huge pile of tabbouleh, which is the other food that has the most selenium. So when I talk about vitamin E in this talk, I'm talking about D-alpha tocopherol. There are 8 stereoisomers, DL isomers, because of the phytol side chain. And there's alpha, beta, gamma, and delta, depending on the number of methylations on the chromanol ring. So alpha has all methylation groups. And this is the natural form of vitamin A that is helpful. Gamma tocopherol, D-gamma tocopherol is also very good for us and especially for our heart. But most synthetic vitamin E's, the bottle will say mixed natural vitamin E, and it's a mixture of 32 isomers, only one of which, D-alpha tocopherol, really helps the skin, and only the gamma might help the heart. But so furthermore, the tocopherol acetate or succinate are not useful on the skin because our skin does not break this acetate, the ester bond here. So it has to be tocopherol to be active on the skin, or you have less than 5% of the activity. And also you need a high concentration. To get any effect on the skin, you need at least 2% and optimally 5%. So the problem is that most creams, if you look, that say they have vitamin E, it's like the last ingredient on the ingredients, and it's the mixture of 32 isomers from the synthetic form. So the vitamin E I'm talking about is entirely different than the vitamin E on most products that you would see. So when I talk about the formulation of topical antioxidants is of extreme importance because they are very unstable. They are antioxidants. When you cut a banana or an apple, it turns brown when exposed to the air. That's the antioxidant doing its job, oxidizing free radicals. But that means that any product with vitamin E is very unstable. So stabilizing it for a commercial cream is really, really difficult. So, and vitamin E must be the D-alpha tocopherol form. The ester forms, again, are stable. So that's the cream won't turn dark brown rapidly, but that is a cream that is not effective. Vitamin C that must be ascorbic acid. Again, I will show you that the ester forms are not absorbed and are not active and are not metabolized. And finally, I will show you that when you mix vitamin C and E with ferulic acid or make microemulsions of vitamin C with E, we can stabilize it and get a synergistically stronger formulation. And finally, selenium, I'll show you, it has to be L-selenomethionine, 0.05%. So now I'm going to talk about each of these separately. And the thing is, we can really increase the level of topical antioxidants by applying it topically. And this makes a reservoir of protection all the time. So with any one of these, you get about the SPF of 2 that you saw that you'd get by applying an SPF 30 sunscreen every hour and a half. So you have a level of 27 times the amount of vitamin C in your skin than you could ever get with an oral, even a very high oral dose. You get a factor of 11 with topical vitamin E 5% and a factor of 8 with L-selenomethionine. And this is in comparison with taking the recommended oral dose that I suggested. You don't get quite the high concentrations in the skin as when you apply it topically. And what I'll show you is that all 3 of these decrease acute sun damage, sunburn, redness, blistering, sunburn cells that we see histologically in tanning, and the chronic damage of photoaging and precancers, actinic keratoses, and skin cancers. So this just shows vitamin E. Now this is a mouse model that we apply either vehicle or topical vitamin D-alpha tocopherol, or give them the oral vitamin E or the topical ester vitamin E succinate. And after the mice are exposed, even though we expose them to light slowly in the beginning, some of them get blisters, but 100% of them get some blistering when you expose them to even low doses of UV. But there was 75% protection against these blisters with topical vitamin D-alpha tocopherol, and there was also protection with the other forms of vitamin E. So taking vitamin E orally helps. You get about 30% protection, but it's not as good as the topical. Now this just shows the pigmentation, which is again a measure of sun damage. So you see the animals that have the topical vitamin E have far less pigmentation than the ones just with vehicle. The oral vitamin E was also protective, and it's a succinate was protective. However, with more and more exposure up to week 20, you still get still tanning, but it's less tanning with the topical vitamin E. Now this just shows the number of skin cancers. So the animals without topical vitamin E started getting skin cancers at about 23 weeks, and that's this line. The vitamin E succinate was not very protective, but topical vitamin E and oral vitamin E were somewhat protective. The topical vitamin E was the most protective. Now, also, applying topical vitamin E retarded the onset of skin cancers, and when we compare this time in mice, it would be by about 10 years in humans. But the reason this keeps going up and these reach a plateau is that at this time, about 50% of the animals not treated with vitamin E had died due to their UV exposure and skin cancer load. So this also increased the longevity of animals exposed to skin cancer, but with time, there are more animals alive to get more cancer. So that's why these lines slowly climb, whereas 50% of these animals had already died from their skin cancer load. And this just shows the topical vitamin E, 5%. When you apply it for 4 months, it really did help these little wrinkles. And if you keep applying it, most of the papers that you see in the literature with retin-A are pictures after 6 to 8 months. So you can see you get real protection. Now, vitamin C is absolutely vital for life, and all animals make vitamin C, whether it's houseflies or mice, but only primates and the Indian fruit-eating bat and the guinea pig do not make vitamin C. So we absolutely need it, and in fact, mice make, if we look at the weight of a mouse, 20 grams of vitamin C, and a goat that weighs about what an average human, a woman might weigh, makes 13 grams of vitamin C a day. So that's why that's why Linus Pauling took 13 grams of vitamin C every day. I recommend about 3,000 of vitamin C. And furthermore, when in stress, animals can increase their vitamin C by a factor of about 12. So it really, stress makes you need more vitamin C. So we lack the enzyme to make vitamin C, but vitamin C is absolutely essential. It decreases skin cancer because it's an antioxidant, and it protects against UVA and UVB damage. But it's absolutely required for collagen synthesis. And that's why in scurvy, first you get bleeding gums because you have no collagen, and in about a year, or less than a year, you might die from vitamin C deficiency. So that's why finally the British, under Captain Cook, learned they should take some limes on board and have a little bit of vitamin C every day. It's required for 2 enzymes that synthesize collagen and cause the cross-linking. So therefore, adding more vitamin C helps wounds heal. It inhibits the enzyme tyrosinase, which makes melanin, so it stops the brown spots. And in fact, it's the best bleaching cream I know. It's much better. It's even faster than the best hydroquinones that we have. And it stimulates lipids and helps the barrier function of the skin. This just shows that L-ascorbic acid is absorbed by the skin and is active. The other forms commonly used, ascorbyl palmitate and magnesium ascorbyl phosphate, are not even absorbed. And if they were absorbed, as I said, this ester bond would not be broken by the skin, or very minimally. Now, if we apply vitamin C once a day, after 3 days we have a sort of saturated level. And if we stop applying it, it takes about 5 days to wash out. So this means even if you protect it, if you do it every second day, you're going to have really significant levels of vitamin C in your skin. And this just shows that when we look at the sunburn cells, histologically we look at the damaged cells in the skin, and we can see that with no vitamin C, there are many, but with topical vitamin E, there are very few. With vitamin C alone, there are very few. But in fact, when we make a formulation with them together, there's synergy and very, very few sunburn cells. And this just shows with increasing MED, you get more sunburn cells, but you always get protection with the vitamin C, E, and better the combination. And this just shows when we look at thymidine dimers in the skin, we see all of the thymidine dimers in these cells, but none in the skin that was just treated once a day with vitamin C and E. And the mice were washed before exposed to sun, before this biopsy. And this just shows again the number of tumors. Now this is the most dramatic that we have, that there are several formulations here, the vitamin C and E together, and vitamin C and E in micro emulsions that I made in collaboration with Japanese collaborators. But you can see the controls get many cancers, and the the animals treated with topical vitamin C and E just once a day and washed before the sun exposure, which shows that the vitamin C had caused this reservoir protection in their skin, did not get skin cancers. And finally, the company SkinCeuticals thought of using this plant antioxidant, ferulic acid, to further stabilize the formulation. Ferulic acid is in virtually every plant. It's a phenomenal antioxidant. It increases vitamin C stability, and it itself is a little bit of a sunscreen. So this just shows what we have, a minimal erythema dose in humans. And we see how red it gets with no sunscreen and with vehicle, but with ferulic acid protects against the UV damage, and C and E alone protect, but with ferulic acid there's even more protection, even at these very high levels of exposure to UV. And this is sort of my favorite experiment with vitamin C. And in this, Cynthia Phillips took fibroblasts from newborns with the blue color and from elderly people over 90 years old. So this was, so she had skin cells after circumcision from newborns. And this side shows that the newborns' fibroblasts proliferated a lot faster, and also they made more collagen per cell than the elderly cells. However, when you put vitamin C in the medium, this was 10% vitamin C, you can see the newborns proliferated 4 times faster, but also the elderly cells proliferated 6 times faster and even outdid the normal neonatal cells in proliferation, and similarly in the amount of collagen they made per cell. So this just shows that vitamin C, first of all, can really help wound healing and can make elderly skin function as well as newborns. And this, if we look very closely at the skin on anyone's arm, young people have this reticulated pattern, whereas older people have these sort of striations and the crepey-looking skin. But if we apply vitamin C, this is an older person, we applied vitamin C once a day for 6 months, you see that the pattern of the skin became more reticulated. So the skin became a lot less crepey. And finally, we can look, now this was a split face study where that was double blind, but we can see clearly after 4 months applying vitamin C, the vitamin C treated side had far fewer wrinkles. It had far fewer wrinkles in this man and brown spots, and again, far fewer brown spots. So now I'm going to talk about selenium. Selenium is a trace mineral that's absolutely required for life. And when I started doing this research in the late 80s, we only knew about 5 enzymes that selenium was a cofactor, for which selenium was a cofactor and an essential cofactor. If you don't have selenium in your body, you die shortly after birth, and this has happened in parts of China. You have a cardiomegaly and death within 2 months. So selenium is absolutely required. And, but now we know 25 enzymes for which selenium is required. But the most important with respect to the skin is glutathione peroxidase, because this is one of the main antioxidants of the skin. And this just shows in parts of the world, this is the United States, where there is more selenium, there is less cancer and less death due to cancer. This graph shows the death due to breast cancer in various countries of the world. So here is America, and it's hard for you to all find your own country. But selenium has been correlated with a decreased cancer incidence for all these kinds of cancer. In particular, and most studied, is prostate cancer and skin cancer. And patients with skin cancers, with melanoma or mycosis fungoides or Sézary syndrome, are all found to have a decreased level of selenium and decreased activity of glutathione peroxidase. And in cutaneous lymphoma, the lower the selenium, selenium is even lower in the higher stages, stage 3 and 4, and it's less, there's less, in the patients that have less response to treatment, the selenium level is lower. So selenium, this shows the patients, and then we did a retrospective study in North Carolina where there are very many people of Celtic descent, red hair, blue eyes, light skin. They're all in the sun, either working as farmers or fishermen or playing golf and swimming. So there's very low selenium and a lot of sun exposure. And the patients that we looked at patients that had skin cancer and those that did not. And the ones that had skin cancer had a selenium level that they were 4.4 times more likely to have the lowest 10% of skin cancer than the other patients without skin cancer. So then we did a large prospective study, a 10-year study in China. And this had 1,312 patients, all of whom had had 1 or 2 cancers within the past year and no other malignancy within 5 years. And they were treated for 4 to 10 years with oral selenium, 200 micrograms a day. And with this treatment, that we surprisingly found that half of the patients died. There was half of the death due to cancer and only 63% of the incidence of cancer. So it stopped cancer mortality and markedly decreased lung cancer, colorectal cancer, and even prostate cancer was 1/3 in the patients that were supplemented with selenium. However, the same number of people, or even like 10% more, got skin cancer. And we now think that's probably because the skin cancers were initiated and already formed because they'd already had 2 skin cancers. And most patients that have had a skin cancer do get subsequent skin cancers. Now, we all, as dermatologists, use selenium sulfide for tinea versicolor, for seborrheic dermatitis and dandruff. This is not absorbed. And I spent a year doing research with selenium sulfide, and it just didn't work. With topical L-selenomethionine, methionine is an amino acid with sulfur. Selenium is just below sulfur on the chemical periodic table. And this is where selenium is in the stores in our body, in methionine and in cysteine. So I think, okay. So if we do tape strimming or radioactive labeling, we see 9 to 12% is absorbed. And we've done this in mice, in rats, and in people by tape stripping. So now when we apply topical selenium, we find that we have none of the animals blisters, 0. And I've done so many experiments over the years, and there's no blistering. There's a lot less tanning, as you can see here, and this is comparing topical selenium with oral selenium so that they all had the same amount, the same dose delivered. And these were the first studies I did. So this was actually very good before we did all the vitamin E and C. But here with no selenium, you see we have lots of skin cancers. With oral selenium, there is a retardation of the onset and a lesser incidence, but that's even more dramatic with this once-a-day topical selenium. Also in humans, we measure that there is an increase in MED, which is dose-dependent. The higher the concentration of selenium applied, the better the protection. Now, then the thing is that we found for the first time that animals, that there were high levels of selenium in cancers. So the question is, did selenium help or hurt the cancers? And this was found in skin cancer and lung cancer. So, and I've showed you already that these antioxidants prolong the onset and decrease the incidence of UV-induced skin cancer. So so we did the following experiment. We had animals exposed to UV, applying only the vehicle. Then we started applying selenium with the first skin cancer. In some animals, we applied selenium until the first skin cancer and then stopped. And finally, I think you're in the way of the film. Excuse me. you kind of cover, you're covering the slides. No, you have to move to your left. Oh, you have to move this way. See how you're in front of the film? So, okay, and finally we applied selenium all the time, and indeed, selenium always decreased the incidence of skin cancers. And the best was the selenium applied all the time. But the good news is if you apply selenium shortly, just after the onset of cancer, which is what we humans do. We don't take care of ourselves until we have a medical problem, and then suddenly we start taking selenium and treating ourselves. So in this case, that also protects against skin cancer. And even if you apply it before and stop with the incidence of the first cancer, you do get protection. So I've showed you that topical selenium decreases the acute sun tanning, blistering, and tanning, and the chronic damage of skin cancer. But now I'll show you that all of these topical agents do actually reverse photoaging. So this shows one patient, and this just shows topical selenium, again, in a 43-year-old with small wrinkles around her eyes. After 4 months of once a day applying topical L-selenomethionine, she had protection. So now in order to test the photoaging, we exposed mice to UV for about 6 weeks and saw that they had aging skin histologically, and then we treated them. Now the gold standard of anti-aging is retinoic acid. So we compared L-selenomethionine and D-alpha tocopherol to retinoic acid. And we analyzed it histologically and by electron microscopy. So here you can see the skin with a thin epidermis, a nice thick dermis, a thin squamous cell layer. After UV, what we see with aging skin is a very thick corneal layer, very thick epidermal hyperplasia, inflammation in the dermis. And after damage with retinoic acid, we get decreased hyperkeratosis, somewhat decreased epidermal hyperplasia, and some reversal of the dermal damage. And if I showed you elastic tissues, you would see a marked improvement in the elastic tissue. But we get that same improvement with topical selenomethionine and topical vitamin E. And in fact, if we graded blind many mice histologically, two dermatopathologists and I, who am not a dermatopathologist, graded all these samples blind. And we found that, first of all, when you turn off the light, there is some improvement in your skin. So just staying out of the sun does correct some of the photo damage. Retinoic acid corrects a lot of the hyperkeratosis, hyperplasia, and inflammation in the dermis and destruction of collagen and elastic tissue. But selenium did even better, and vitamin D topically did even better than topical retinoic acid over the period of treatment. Now this shows electron microscopy. Before UV, we see this is the DE junction that's intact, and we see that the dermis has nice collagen that's dense with homogeneous bundles. The bundles are arranged parallel. But after UV, we see this sparseness. There's lots of destruction of collagen. The bundles are irregular and dispersed. And the DE junction is now, the anchoring fibrils are destroyed. However, after treatment with any one of these things, topical retinoic acid or selenium or vitamin E, we see this great improvement. We see that the DE junction has the anchoring fibrils again. There is not a lot of extracellular matrix. There is a lot of collagen, and the fibrils are arranged parallel, and they're denser. So there is no doubt that topical antioxidants can protect the skin from environmental damage. But in order to assure something works, as I've showed you, you need the correct molecular isomer. It cannot be an ester because that's not broken by the skin. You have to have a high enough concentration and a formulation that is stable. So for vitamin E, it must be D-alpha tocopherol, at least 2%, and 5% is better. For vitamin C, it must be ascorbic acid, not the ester, and it must be 15 to 20% is optimal. And L-selenomethionine, it has to be that form of selenomethionine and 0.02 to 0.05%. So I've showed you that sunscreen is not enough for sun protection, but and that there is, because we can't apply enough often enough, and it doesn't protect against other environmental free radicals. So, and topical antioxidants give a higher concentration in the skin than we can get even with oral vitamins, and it provides a reservoir of protection that's not washed or perspired off. And not only does it protect, but it reverses previous damage. So you'll get fewer skin cancers in the future, fewer precancers, but you'll also look years younger if you apply any one of these, but better, better yet all three, topical antioxidants to your skin. And as George Byrne, who's an American comedian, said, he said, you can't help getting older, but you don't have to become old. You don't have to become old in your mind, and you don't have to look old. So now we can protect ourselves. Thank you.